Enbrace Hr is a combination multivitamin, mineral, and fatty acid product that is used to treat or prevent vitamin deficiency before, during, and after pregnancy. It contains important building blocks of the body and helps keep you in good health. Additionally, it also contains iron and folic acid, which are essential for women of childbearing age to maintain adequate levels to prevent infant spinal cord defects in the developing baby. It is important to take this medication as directed by your healthcare provider. The recommended daily dosage and optimal timing for taking Enbrace Hr may vary, so it's best to consult with your healthcare provider for personalized advice. When taking Enbrace Hr, it is recommended to take it by mouth, usually once or twice daily as directed by your doctor. If you are taking the powder form, mix it in water before swallowing. If it's the delayed release form, do not crush or chew it. It is best taken on an empty stomach 1 hour before or 2 hours after meals, with a full glass of water unless directed otherwise. If stomach upset occurs, you can take it with food. Avoid antacids, dairy products, tea, or coffee within 2 hours before or after taking this medication. Remember to take it regularly at the same times each day for the most benefit. If you experience constipation, diarrhea, or upset stomach, these effects are usually temporary and may go away as your body adjusts to Enbrace Hr. If any of these effects persist or worsen, notify your doctor or pharmacist. Iron in this medication may cause your stools to turn black, which is not harmful. It's important to remember that this medication has been prescribed because your doctor has determined that the benefit to you outweighs the risk of side effects. Many people using this medication do not experience serious side effects. However, you should notify your doctor immediately if you experience any serious side effects, such as easy bleeding or bruising. While a very serious allergic reaction to this drug is rare, seek medical help right away if you notice symptoms like rash, itching or swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, contact your doctor or pharmacist. Accidental overdose of products containing iron can be very dangerous, especially for children under 6 years old. It's important to keep Enbrace Hr out of reach of children at all times. If an overdose does happen, it's crucial to seek medical help immediately or contact a poison control center. Remember to always store medications in a safe place, away from children's reach. Before starting Enbrace Hr, it's important to let your doctor or pharmacist know if you have any allergies to its ingredients, fish, or soy/peanut. This medication may contain inactive ingredients that could cause allergic reactions or other issues, so talk to your pharmacist for more information. Also, make sure to inform your doctor or pharmacist about your medical history, especially if you have iron overload disorder, alcohol use/abuse, liver problems, stomach/intestinal problems, vitamin B12 deficiency, or bleeding disorders. If you are planning to have surgery, it's essential to let your doctor or dentist know about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. Enbrace Hr is safe to take during pregnancy when used as directed, but it does pass into breast milk, so it's important to consult your doctor before breastfeeding. As for the daily dosage and optimal timing, it's best to follow the directions given by your doctor or pharmacist. They will be able to provide you with specific instructions based on your individual needs. In the How to Use section, it is important to be aware of potential drug interactions that could affect how Enbrace Hr works or increase the risk of serious side effects. It is essential to keep a list of all the products you use and share it with your doctor and pharmacist, including prescription/non-prescription drugs and herbal products. Do not make any changes to your medication dosage without consulting your doctor. Enbrace Hr may interact with products such as chloramphenicol, certain anti-seizure drugs like phenytoin, and methyldopa. This product can also decrease the absorption of other drugs such as bisphosphonates, levodopa, penicillamine, quinolone antibiotics, thyroid medications, and tetracycline antibiotics. It is recommended to separate the doses of these medications as far as possible from your doses of Enbrace Hr. Consult your doctor or pharmacist for guidance on how long you should wait between doses and for assistance in finding a dosing schedule that works with all your medications. If you or someone else has taken too much Enbrace Hr and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help by calling 911 or your local poison control center. In the US, you can call 1-800-222-1222, and in Canada, you can call a provincial poison control center. Signs of an overdose may include stomach pain, nausea, vomiting, and diarrhea. It's crucial to get help right away in case of an overdose. Remember, it's important not to share Enbrace Hr with others. While taking this medication, you may need to undergo lab and/or medical tests to monitor your health. It's important to keep all scheduled appointments with your healthcare provider. If you have any questions about these tests, be sure to consult your doctor for more details. Some prenatal vitamins also contain additional ingredients such as calcium, zinc, iodine, or docusate. If you're unsure about the ingredients in your prenatal vitamins, it's best to consult your doctor or pharmacist for clarification. It's essential to remember that Enbrace Hr is not a replacement for a healthy diet. It's important to continue eating a balanced diet and follow any dietary guidelines provided by your doctor. Getting your essential vitamins and minerals from healthy foods is always the best option. As always, it's important to consult your doctor for the recommended daily dosage and the optimal timing for taking Enbrace Hr. If you forget to take a dose of Enbrace Hr, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take a double dose to make up for the missed one. Make sure to store Enbrace Hr at room temperature, away from light and moisture. It's important not to keep it in the bathroom, and always keep it out of reach of children and pets. Remember not to flush Enbrace Hr down the toilet or pour it into a drain unless your healthcare provider tells you to. When it's expired or you no longer need it, make sure to properly discard the product. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.